Today, we are going to discuss common chronic conditions adults 40 plus on Medicare were treated for in 2024 and what you should know about each. While you're learning more about how live with one of these chronic conditions, you might want to consider a medical alert monitoring system to help maintain independence. Before moving to the video, do not forget subscribe the channel and like the video. I hope you get better soon and live a healthy life. 1. Heart disease. According to the CDC, heart disease remains the leading killer of adults over age 65, accounting for 489,722 deaths in 2014. As a chronic condition, heart disease affects 37% of men and 26% of women 65 and older, according to the Federal Interagency Forum on Aging-Related Statistics. Dr. Bernard's advice for addressing this senior health risk: exercise, eat well, get a good night's rest. 2. Diabetes. The CDC estimates that 25% of people ages 65 and older are living with diabetes, a significant senior health risk. According to CDC data, diabetes caused 54,161 deaths among adults over age 65 in 2014. Diabetes can be identified and addressed early with simple blood tests for blood sugar levels. The sooner you know that you have or are at risk for diabetes, the sooner you can start making changes to control the disease. 3. Obesity. Obesity is an important senior health risk factor for heart disease, diabetes, and cancer, all chronic conditions that impact quality of life. As the numbers on the scale increase, so does the risk for disease. Of the adults between 65 and 74, 36.2% of men and 40.7% of women are obese, meaning that their body mass index is greater than or equal to 30, according to the CDC. 4. Influenza and pneumonia. Although the flu and pneumonia aren't chronic conditions, these infections are among the top 8 causes of death in people over age 65, according to the CDC. Seniors are more vulnerable to these diseases and less able to fight them off. Senior healthcare recommendations include getting an annual flu shot and getting the pneumonia vaccine if recommended by your doctor. 5. Oral health. Healthy teeth and gums are important not just for a pretty smile and easy eating, but also for overall senior health. According to the CDC, 25% of adults over 65 have no natural teeth. As you age, your mouth tends to become drier and cavities are more difficult to prevent, so proper oral health care, including regular dental checkups, should be a senior health care priority, Dr. Way said.
6. Poverty. In 2013, 45% of adults ages 65 and older had incomes below the poverty level, according to a 2015 Kaiser Family Foundation report. This number takes into account available financial resources, liabilities such as taxes, value benefits like food stamps, out-of-pocket medical expenses, geographic variations in housing expenses, and other factors. Older women are slightly more likely than men to be living in poverty, and that gap widens in those over 80. Single older adults are also significantly more likely to live alone with fewer resources. Poverty affects senior health if you're unable to afford doctor visits, medication for chronic conditions, and other essential senior healthcare needs. 7. Shingles. Remember that bout of chickenpox you had as a kid? It can come back as shingles when you're an adult. According to the National Institutes of Health, 1 out of 3 people over 60 will get shingles, and 50% of all Americans will experience it before they're 80. It usually affects only one side of your body, starting out with severe pain or tingling and then developing into an itchy rash and possibly blisters. There is a vaccine available, so talk to your doctor about it. 8. Falls. The risk for falls requiring emergency room care increases with age. Each year, 2.5 million people ages 65 and older are treated in emergency departments because of falls, according to the CDC. That's more than any other age group. And 1/3 of people who go to the emergency room for a fall may find themselves there again within 1 year, according to a study published in August 2015 in the American Journal of Emergency Medicine. Also be aware that most falls occur in the home, where tripping hazards include area rugs and slippery bathroom floors, according to a study published in January 2013 in the Journal of Injury and Violence Research. 9. Alzheimer's disease. Alzheimer's disease accounted for 92,604 deaths of people over age 65 in 2014, according to the CDC. The Alzheimer's Association reports that 1 in 9 people age 65 and older, which is about 11%, have Alzheimer's disease. But because diagnosis is challenging, it's difficult to know exactly how many people are living with this chronic condition. Still, experts acknowledge that cognitive impairment has a significant impact on senior health across the spectrum, from issues of safety and self-care to the cost burden of care, either in the home or a residential facility. 10. Arthritis. Arthritis is probably the #1 condition that people 65 or older contend with, says geriatrician Marie Bernard, MD, Deputy Director of the National Institute on Aging in Bethesda, Maryland. The CDC estimates that it affects 49.7% of all adults over 65 and can lead to pain and lower quality of life for some seniors. Although arthritis can discourage you from being active, it's important to work with your doctor to develop a personalized activity plan that, along with other treatment, can help maintain senior health.